Now let's talk about infections of larynx. Very important. Multiple question has been asked in the exam. Lot of time. So basically, you'll study about three pathologies. The first pathology is acute epiglottitis. Very important. Multiple time examiner asked this question. So let's draw a simplified diagram of epiglottis, how it is happening. This is thyroid cartilage, this is my epiglottis, this is my cricoid cartilage, which is a complete ring. Over the cricoid cartilage, there are two arytenoids. From the arytenoid, the vocal cords are getting attached. So basically, this is a sagittal view. Okay, of the larynx, and from there then comes the multiple tracheal rings. Now what is happening in epiglottitis? That is a type of bacterial infection. What is the most common organism causing the acute epiglottitis? Nowadays the most common organism is GABS, group A beta hemolytic streptococci. Everything is written. Earlier, the most common cause found to be Haemophilus influenza. So basically, acute epiglottitis, it's a bacterial infection. Mainly affecting child of age group between 3 years to 6 years. So basically, around the age would be around the 3 years, 4 years, 5 years. So the clinical presentation will be like this. Now, what is happening in acute epiglottitis? Because of the bacterial infection, what is happening? The supraglottic part. Name says epiglottis, but generally the inflammation is involving the supraglottic part. So what is happening? This epiglottis will get swollen up, bulge, edematous. So if this got a bulge, along with the bulging of the false vocal cord, airy epiglottic folds. So what will happen? Because of this inflammation, the laryngeal inlet, supraglottic part will be edematous, leading to blockage of laryngeal inlet. And if suppose there is a mug and there is a cap, if I suppose there is a bottle and a cap over this, and if this cap got bulky, so if this got bulky, will the this inlet will be blocked? If this is blocked, can the air be passed inside freely? No, there will be difficulty. So what is happening in acute epiglottitis? Basically, supraglottis part, supraglottic structures, epiglottis, folds get edematous, leading to blockage of laryngeal inlet. So this will result in, if air can't pass inside, if the entry is blocked, so what will be there? There will be stridor, dyspnea. The clinical presentation will be stridor, dyspnea. Since it's a bacterial infection, patient may have fever, febrile. It is febrile. Baby may have toxic look. Why toxic look? Because he can't breathe properly. There is fever. Already body is dull. He can't eat properly. Why can't eat properly? Because epiglottis, the laryngeal inlet, is a structure which is an inlet or the starting level for both what? Larynx and esophagus, because that is the entry part. If some deformity is in the entry part, what will happen? So patient, whenever he try to eat something, the food will touch to the epiglottis or airy epiglottic fold, because AE fold are the boundaries of the pyriform sinus also. If we see the laryngeal inlet, on both the side there is pyriform sinus, and from the pyriform sinus, food is then going into the postcricoid region. That's how food pass. If suppose this area